Good morning. Good morning, San Ildefonso, Pueblo. Hope that anyone is watching, they can hear. All right. So today is June 16th. It's a Thursday, and we're here today with our COVID Live update. We'll give a few minutes for everyone to get in and settled, and get some viewers. I see that we do have one. We'll go over our numbers here at the Pueblo for COVID. We currently have one active case. So far, no new cases today. New for the last 7 days, from the 13th to the 19th of June, were 4. Our total positives tally up to 238, with a total recovered number of 235. It's just, is that you, Troy? We have one person in isolation for an active COVID case. So it's good that we're seeing folks recover from their COVID cases, and we're not seeing a lot of numbers, but it's a testament to everyone's commitment to each other to try to keep each other safe and healthy. I'm sure everyone's washing their hands and hopefully wearing masks where they find there's a lot of people when it's appropriate. Joining us, we have LaDawn Yazzie, our health educator. Raylene Martinez is listening in from SDPI. Thelma Gonzalez, our CHR. And COVID cases in the state are continuing to slightly rise. Things don't appear to be out of control. However, they are maintaining some numbers in the low hundreds. Bring my sheet with me. Bring up the numbers from yesterday. Yeah, looks like for the state of New Mexico, as of yesterday, we had 165 hospitalizations, 17 people on ventilators, 4 new deaths, and 1,132 new cases for the state. So all in all, things are sort of maintaining at a certain level. And today I wanted to talk really briefly about monkeypox. In case people are concerned or want to know more about it, I wanted to be able to provide that information so that it's easier to understand. Let's see. Just bear with me for a moment while I get this together. Does anyone from the various departments have anything to add or that they would like to talk about? Thelma.
Guatemala. I was just trying to get on here so I can notify the community that we had a men's health, health and for men's health awareness. Sorry, scheduled this month, and it's supposed to be on Wednesday, June 22nd. We will have to cancel that, and it is going to be rescheduled for June 29th on Wednesday. And again, this is a men's health. It's for the awareness month for June, and it's going to be at the senior center. But again, the date's going to be a Wednesday, June 29th, and the time is at 5:30. So if you have any questions, and we will be going ahead and updating this probably on Facebook and just letting you all know out there. And yeah, just share it with your any male ages from 12 and over to let them know that it's going to be rescheduled. Thank you.
Thank you. All right. Let's see. Hi. I just wanted to share that today we will have another podcast after lunch, so join us if you're available. And it will be in regards to the kits, the farm kits or the gardening kits that we received from Sembrando Salud. And so a few of the community members who did sign up a couple of weeks ago received soil information, seeds, and also a drip line, a starter kit basically to get drip line started for a small garden. So yeah, join us. It's at 1 o'clock today, and we'll be meeting, talking with Artie Ozzie, Master Gardener, who is coming in or who's going to join us live from Arizona. So yeah, come out and join us. That sounds like fun. All right, I'm going to go ahead and just share my screen. So here we have some basics about monkeypox. And I do want to enlarge this a little bit. So in the United States, we currently have less than 100 cases as of yesterday. And we don't have any cases in New Mexico currently. We do have cases surrounding us in surrounding states. Oklahoma, Texas, Colorado, Utah, Arizona. There aren't many cases in those states, but it's important to note. So essentially, you know, what is monkeypox? We hear something with the name pox in it, and it can vary from being really scary sounding, or some people think, oh, it's like the chicken pox, but it's not quite related to the chicken pox as much as it is related to smallpox. The current strain that is in the United States primarily is the milder strain, which is the West African strain. This monkeypox comes originally from West and Central Africa. And you can see they have the two different strains sort of mapped out here from origin. And the symptoms that are typical with monkeypox can seem mild from just fever, muscle aches, headache, sort of a rash that can vary from looking like pimples to looking like big, what they call pustules, which doesn't sound too pleasant. But that's essentially how the case presents. Also, swollen lymph nodes can be a sign, and typically lymph nodes can be in your neck. The prominent ones that become inflamed can be in your neck. There are some in the side of your neck, and your throat, your chest, and your axilla or your underarms. And they usually get tender, so that's another sign. As far as how it spreads, there's some argument that this is typically a contact spread disease, and that is mostly true. So if you have contact with somebody who has monkeypox and has the sores in their skin, that's usually the route of transmission between humans and animals. There are some instances where if you're in close contact with someone and you're in a very enclosed area, that it's possible that that infectious substance from the sores or from the respiratory system can spread through the air. It's not incredibly common, but it is possible. So it's important to remember that. And again, primarily ways of preventing transmission between people and between humans is hand washing, cleaning surfaces. If somebody has symptoms, there are typically the skin eruptions. You just want to make sure that laundry is done and that surfaces are cleaned and that hand hygiene and things like that. Can it be cured? It's actually what we know as self-limiting. So it tends to peter out on its own after 2 to 4 weeks. There have been extreme cases. I believe usually, as the trope goes, usually it's folks who have never had the smallpox vaccine or never had that inherited immunity. If you go back to when we eradicated smallpox, we did that with a vaccine. And that's why it's not typical for folks to be vaccinated with the smallpox vaccine in modern days. In history, there are definitely many people who received the vaccine and are still with us today. So I think that also contributed to part of the eradication of smallpox. So for folks who do get it, there are treatments. It can be, I have an echo. Not sure where the echo is coming from. Hopefully that's better. Sorry it took me so long to respond. That's the problem with screen sharing, I think. So anyways, antivirals and immunoglobulin is typically the first line treatment, but prevention is key. There's nothing to get enormously excited about, but we all just want to make sure that we're aware of the things that are going on today and keeping ourselves healthy. So that is essentially all I have on that topic. Are there any questions about that? Add people back to the stream. Do I still have an echo? Oh, good. Excellent. Anyone have any thoughts on any of that or any of the COVID information? I know that we're still doing our walks on Tuesdays and Thursdays. What time are we doing that? Does it start at 8:30?
Good morning, ladies. This is Raylene. I'm sorry, Rebecca. Had
Still doing
something
those
come up. This is Raylene Martinez. Good morning, everybody. We have walking, as Rebecca stated, on Tuesdays and Thursdays at 8:15 a.m. We do meet at the baseball field, and we walk for about half an hour, or more so as long as you wish. I also want to remind everyone that we do have gym memberships available to tribal members living here in the community. The facilities are Anytime Fitness in Los Alamos or Espanola, as well as the Pueblo Wellness Center. I'm sorry, can you all hear me? Okay. I You do have to complete a fitness assessment prior to you receiving a gym membership. If you are interested in that, you can give me a call or you can shoot me an email, but you can call me or text me at 505-660-8927 and we can get that scheduled for you. Just also want to remind you all that we also do have nutrition consultations that are available for one-on-one or in a group setting, such as a family. If that's something that you would like to take advantage of, please contact me as well. And I think that's my update for right now. Thank you.
Thanks, Raylene. Yeah, sorry about that, Lillian. I don't know if it's me that's really loud or the computer system. But it's a little bit of a learning curve to learn some of this technology. So we're happy to have you here, though. Shall I give it a try? I'm a little nervous to say.
All right, how's that sounding? You hear the echo still? Better. Okay, great. All right. Yesterday, was it yesterday or 2 days ago? We had a special guest come in. We had Jeffrey Folgate from Santa Fe County talk a little bit about fire safety, and we did our best to highlight some of National Nutrition Month information in the previous, in this month's bulletin. We shared, refrigeration, food safety basics, and then this next time around, we shared fire safety information, fire readiness, because of the spike in wildfires and some of the challenges that the county is going through. We also just wanted to make sure that everyone's aware of the details or some information that goes unnoticed. We got information about carbon monoxide alarm, fire alarm, And so that information is available in our previous podcast that was recorded, and it's shared on Facebook and our YouTube page. So if you have any questions or you want to watch that podcast, that's available now. Then, like as mentioned, we'll have another guest coming in this afternoon to talk about a little bit about gardening. So I hope that's helpful going forward. We have other activities taking place right now. We have a community health assessment that is taking place at the Tewa Center, I believe it is. And we have Aztec, Albuquerque area tribe, Southwest Tribal Epidemiology Center. We have a few representatives there. So go on over and get that questionnaire or survey completed to receive a gift card. I think that's a great opportunity to provide us with feedback. So a lot of the times we are trying to figure out how can we help the community? What is it the community needs, or what are some of the challenges that are health related that we can target and help. So this is the community's opportunity to provide us with information. The questionnaire is not going to take too long, but in the end, it'll provide us with information that's vital. So going forward, we'll be able to look at those challenges, that information, so that we can create a health plan or just the way of navigating some of these elements that are bothering individuals, or that are most talked about in the community. So we would like your feedback. Community health assessment is taking place at the Tewa Center today. So that's something everyone should consider, everyone in the Pueblo. The bonus is the gift card. So yeah, thanks for listening.
Awesome. Thank you so much, Ladon. So the other update that we have that we wanted to share is the good news that the FDA advisors approve recommendation of the COVID-19 vaccine shots for children under 5. So we are a step closer to getting infants, toddlers, preschoolers vaccinated. They are essentially giving a thumbs up for Moderna's 2 shots for kiddos. They're going to vote later on whether Pfizer's 3-shot series is good for them. So now the CDC has to approve. So that's essentially what we'd be waiting on. Usually they will approve within a week or so of the FDA's recommendations. So we just have to be patient for hopefully just a little while longer before we can get our little ones vaccinated and protected. I think that's really going to help cut down on transmission, because I know a lot of children here and all around the country, their families participate in childcare during the day while parents are working. So I think this is going to be a major step in reducing the transmission of COVID-19 and getting those numbers as close to 0 as possible. One can hope. So that's really great news. And I think that's all I really have about that. If you have questions about that, you can definitely contact us. Or for right now, we're still waiting, like I said, on the CDC approval before they're going to move into the phase of authorizing and distributing vaccines for children under 5. So that is something to look forward to. Also, in other news, I believe it's through the Learning Center, and they're having the after school program. I'm going to be participating along with my coworkers in different presentations for our youth. I'm going to be explaining hand hygiene and how bacteria spreads and what that really doing demonstrations to show what that kind of looks like. So if you have little ones in the after school program, they can look forward to doing some fun activities and maybe learning something they already know again or learning something new. I think we'll have some fun doing that. And I'll be there next Tuesday and then the following couple of Tuesdays to do a few different projects. So that'll be exciting. If any of our listeners have any questions or concerns, love to take some time to answer those questions. Also, more news on the community health needs assessment surveys. So far, we have 126 completed. So that's really great news. We still want to hear from everyone possible. And that surpasses our previous turnout. So we're really excited that this survey is going to help the community. It's going to help us understand the needs of the community and what all of you out there want to see happen and want to see change and try to work towards those things. So things are looking really good on that, getting those surveys filled out. And we really appreciate all of you that have come out and to our events and participated, taken the time to fill out the survey, and also shown us a great deal of patience and courtesy when we've had a few little technological difficulties. It's really important that we hear from the community on all aspects of what we have in the survey so that we can better understand the things that we need to work on in the future. And also we can understand the strengths of the community and use those to our best advantage as like a team. So it's really cool to see that happen.
I have a question for the community. We have quite a few community members. I would like to know what is the challenge, or what are the challenges of getting that community health assessment completed? Is it the timing? Is it something that you're questioning? Like, well, what's the purpose? I'd like to know. We have, again, the Tewa Center will host Aztec to provide that community health assessment today from 9 to 3. So if possible, you go there, take the health assessment. You can either take it online. They have tablets for you to complete the questionnaire. And then they also have a hard copy or a paper version for you to complete. We had a goal to complete more than, it looks like, 110 questionnaires, but we're moving forward to try to reach 200. We would like 200 assessments or 200 questionnaires back from the community. So we have we have some time. We're being optimistic. So if we can get a few more people over to the Tewa Center to complete that information, that would be awesome. That would be great if we got a few more. So help us out. Help yourself out. It would be great to get the information back from you.
Yeah, so it looks like ASIC will mail out the rest of the surveys starting next week. So you get a survey in the mail, and please fill it out for us. If you have questions or concerns, please let us know. We're happy to address things on. We're working extremely hard to maintain anonymity for those who fill out the survey. So it's really important. Your answers are important to us, and protecting your information is very important to us. The survey is going to close on June 30th. So, being June 16th, there's still plenty of time to fill out our survey. It's a very robust survey, and we want to hear from as many people as possible.
I find it very interesting when Troy's not here. He usually runs the show, and here we are. He's still guiding us. So he's guiding us to this podcast. So we're learning, which is good. We're struggling, every now and then. We have technical difficulties again. It sounds like I got an echo here. But we're doing the best that we can. Troy's helping us along the way in the chat, letting us know, hey, don't forget this. He's still behind the scenes. He's still working. So we want to thank Troy, even though he's not present here, physically present, but he's still helping us out, and we're really thankful we have Troy to help us out. So, and everyone else will watch this later. So.
Well, no, Troy has the gift of the gap.
It makes the podcast complete easy. We just are leading and
filling in today. So we're not as experienced, but I think we do okay. And
we're awesome.
And we're gonna have more guests on our live stream. So looks like aging and long-term services are gonna come and join us on our live stream. We're always looking for opportunities to talk a lot on our live streams about the things that are going on around us. IHS is going to be coming on. And we'd like to use this opportunity to keep everyone informed and give people chances to ask questions and learn new things. So anyone ever have suggestions about what they'd like to see, we are open to hear those suggestions, and we'd love to hear that feedback. And maybe you want to come be a guest and speak on something that you have experience with or are an expert in. We'd love to give you an invitation and have that happen. And it's a great opportunity for us to be able to learn from one another and share our experiences, because as a community, that is just this is a great resource to have at our fingertips. So we all need to take advantage of that. And that's mostly it for that. If there's anything else to add? Not that I know of. Yeah. So I think I think we're going to wrap it up for today. I know it's a bit earlier than normal, but we have enjoyed having this opportunity to broadcast to you all. And again, if you have questions, want to participate in our live stream, or don't forget to fill out your surveys if you haven't already. They'll be mailing out next week, so keep your eyes open for those. And if you have, any other questions or comments out there, feel free to post them. I'll give you a couple of minutes, and I would normally play some background music for us, but sometimes that causes a little glitch in the system. So beautiful day out there. It's gonna get warm. I'm not much of a weather person, but it's always a good day when the sun is shining. So
Thanks for joining us. Looks like we're going to have a 3-day weekend. Is that correct?
It is
We're
a
gonna,
great weekend.
yep. So I hope everyone stays safe. Don't put your guard down if at all possible. Stay masked, wash your hands, social distance. Just be cautious. Be safe out there. Thank you for joining us.
yes, enjoy the 3-day weekend. Wash your hands, wash your hands, wash your hands, and have a great day.